Dr. John Lawrence. I'm a chiropractor and naturopath, and tonight we're going to be talking about MarrApose with LumeStem stem cell activation. And I feel qualified to speak to you guys about this subject tonight because I have lots of experience in the field of regenerative medicine. We have an integrative center here where we have a podiatrist who's also an orthopedic physician assistant. We have a family practitioner who's a DO. We have an MD, and we have an acupuncturist. So we've got the bases covered. But I'm going to be describing some technical aspects of biology tonight. I'm going to be talking about some really cutting edge, revolutionary healthcare model aspects of healing the body through regeneration versus managing symptoms with medications and such. I truly believe that this is really going to be the future of how we're going to care for ourselves, and I think after tonight you're going to kind of see that as well. I'm also going to be sharing some personal stories of my personal journey and my experience with some injuries I've had with treated with stem cells and platelet-rich plasma. I'm going to be describing all of these things tonight. All right, so for many years there's been political aspects that have kind of suppressed regenerative medicine, and that's changing. The tides are changing very quickly. Typically, we get an injury, we have pain, we go to the doctor. Typically the doctor in a healthcare insurance model is going to prescribe you a medication, whether it's a pain medication, an anti-inflammatory, a muscle relaxant, and he might give you a prescription for physical therapy, you know, it depends. But we're really a prescription-based healthcare model, okay? And when this model fails, then we'll find ourselves in a surgical situation. And surgeries are generally repairs of tendons, joint replacements, surgeries to remove different types of spurs and so forth. What's between this is really what we're going to be talking about tonight, is the gap that has here, because this is pretty extreme when you start to realize how regenerative injection therapy with different types of biological substances can literally stimulate your body to repair itself when all it is just an injection versus cutting things open. So what is regeneration? It's the process of renewal, restoration, and growth that makes cells, organs, organisms, and ecosystems resilient to natural fluctuations or events that cause disturbance or damage. And according to the U.S. government, the Accountability Office, they say virtually any disease that results from malfunctioning, damaged, or failing tissues may be potentially cured through regenerative medicine treatments. Stem cell and tissue-based treatments have already proven to be successful in curing diseases like sickle cell, and recovering stroke victims have been helped during their rehab phase by utilizing stem cells to repair damaged brain tissue. So even our government is starting to see this. So this is a hilarious little cartoon here, especially here in Sarasota, because we could actually imagine that going on, right, downtown? Like that kind of looks like the post office downtown. So this area of medicine is really just amazing. However, the responsibility that a physician would have to provide this therapy for you without properly diagnosing and being able to get this substance to the exact spot is critical, because it can make or break whether the treatment works. So I like to tell my story that really got me solid into this business of regenerative medicine was a wrist injury. And I was paragliding in Hawaii, and I fell, probably almost killed myself, came down on a rock on my hand like this, and my hand was all cut up, my arm was cut up, but my wrist, it never stopped hurting. And we had been doing some regenerative injection treatment in our office, but it was very early on in those days. And I had a doctor that was working for me, and he did some injections in my wrist, and it didn't really work. And so we were kind of trying to figure out what was going to work and what was going to work for. And so the injections I was getting in my wrist were with the blood, with the platelet-rich plasma. And I had 2 of them, and they helped temporarily. Shortly after, we were all at a conference in Naples, and this was a seminar where a lot of doctors go to learn, from all over the world they come, and experts that are doing regenerative medicine go there to teach. And at the end of this seminar is a practical where doctors will actually get treated as patients and we'll all watch. And so I volunteered myself, and I really didn't expect anything, but I figured it was worth a shot, right? So they called me to the table. I go to the table, they had my blood prepared, and there was a man there at the table, and he had a machine that looked just like this back here. This is an high-definition ultrasound machine. And he started to scan my wrist, and he started to name off these different ligaments. And he said, well, also this triangular fibrocartilage, big piece of cartilage in there, there's a big tear in it. And he showed me, and I could see it. And it's in real time. And then so he called the doctor to the table, and he guided her right into where the damage was. And I was really impressed. I mean, just that was impressive alone. What was even more impressive is within like 3 weeks, my wrist was perfect, and I haven't had a problem since. And it was that experience, because when you're in it and you actually have that for years, that type of injury, and then it's healed just like that, you just get it at a level that is hard to get if you read a textbook. And so I got it, and I really saw that this is the future of medicine, is to be able to guide these, especially with orthopedics. If you can guide these things into the right spot, the technology just keeps on getting better and better with stem cells. So, high definition ultrasound. So after that experience, I decided that I wanted to become the best ultrasound sonographer ever, right? So I went to every class I could possibly go. And what was even more amazing is when I had that experience in Naples, the gentleman that did the scanning was an expert sonographer who was also a chiropractor. So I could really see that there could be a really good team with being able to diagnose and guide these injections with the right medical staff. So this is from the Journal of Rheumatology, and they took rheumatologists who do a ton of injections, and they had a minimum of 15 years of experience. They had 15 years of experience injecting, and they said, well, let's see how accurate these experts are. So they had a little dye that was put in the injections. And so the percentage was, in the shoulder, it was only 40% accurate into the joint. Excuse me. Can you believe that? Can you imagine 40% accurate? Would you want to pay thousands of dollars for a stem cell injection and it not be guided when it's only 40% with someone that has 15 years of experience doing multiple injections every single day? So it was only overall 64%, where the ultrasound guided group, they took these a group of the rheumatologists and taught them how to use ultrasound, 92%. So let's talk about LumeStem, LumeStem technology. This is something that is very unique to advanced rejuvenation. And LumeStem uses laser therapy. Now, what you need to know is that laser, the red color, the spectrum, so when we have the sun, we have all the different spectrums in the sun, all of them together. So you can take out different colors if you have the right equipment. You can also create these different spectrums, and the red has the most penetration into the body. But did you know 70% of that light is absorbed in the first millimeter of the skin? So you don't get a lot that goes into the body. So when we have an external laser here, and it's this $60,000 laser, the head's like this big, and it's got to produce like 20,000 millivolts. And we get penetration, but the majority of it is in the skin. So we have to have some pretty extensive, and you're still not getting a lot deeper. You don't get the effect. So why would you want to be lasering tissue anyway? Well, Laser's been around for a long time, and they've found that laser does some pretty amazing things to actually regenerate human tissue, to repair tissue, and also to allow tissue to function more efficiently by giving it energy. So part of LumeStem is interstitial laser therapy. So we're going to talk about a few aspects of the application of LumeStem. Okay, there's interstitial, there's interarticular, and there's intervascular. Okay? So with interstitial, we're talking about being in tissue. We're not in the joint, but we're in the tissue. So where would this come into play? Very often we treat the spine, and we can actually take and feed the laser through a special catheter. So it's a needle, and by the way, we can inject the stem cells through that same needle. We can advance this tiny laser, very powerful laser, right onto, say, like a nerve root. We had a patient last week, lady lost motor function, was in a wheelchair. One treatment, she came back, she was able to move her leg. So it's very powerful. We're able to use various colors, and we're going to talk about what the different colors do in a second, but all the other colors virtually don't even penetrate the skin, so you can't get a lot of these physiological effects unless you're able to get it close to the tissue. In the spine, a lot of these areas of damage in the spine are very, very deep in there. So we're able to penetrate depths up to 12 centimeters. Compared to external laser, this therapy and this technique has significantly improved therapeutic results. So green, yellow, and blue lasers, which are normally absorbed already in the surface of the skin, can be applied into deep tissue where they develop their anti-inflammatory effects. So interstitial laser, some of the common applications that we use for this is chronic spinal disorders, herniated discs, scar tissue after disc surgery is very good for, spinal stenosis, nerve lesions, tendinitis, and strains. So now we're going to talk about intra-articular laser. This is where we're actually able to laser the surface of the cartilage. So if you were to take an external laser and hope to actually get a large effect into the articular cartilage, you would be fooling yourself if you were able to do that with an external laser. But if you're able to take the laser into the joint, there's a picture here. You can see when the laser's in that joint, the whole joint lights up. If we turn the lights off in the room, the entire joint like photoluminesces. So it's very, very powerful. Intra-articular laser therapy is used primarily in the treatment of damaged joint by application of a newly developed catheter technology. It allows direct irradiation of dysfunctional tissue, nerves, cartilage, bone. There are already many scientific studies that are clearly demonstrating the regeneration of cartilage tissue by means of low-level laser therapy. While red lasers are mainly used for regeneration and chronic joint pain, blue light is particularly effective in the treatment of acute inflammation due to its anti-inflammatory effects. To optimize effects, the treatment may also be combined very successfully with other injections, such as platelet-rich plasma and stem cells. So LumeStem therapy for intra-articular is typically used for knee joint arthrosis, any type of inflammation of the joint, hip arthrosis or arthritis, chronic shoulder arthritis and syndromes, and ankle arthritis. Really anywhere there's arthritis in the body. Okay, so now we are at stem cells. Okay, we've gone on a journey, and now we're at stem cells. So stem cells are generally defined as undifferentiated cells that are capable of self-renewal through replication, cells that differentiate into specific cell lineages. Adult stem cells are necessary to maintain tissue and organ mass during normal cellular turnover. Mesenchymal stem cells. These are the ones we use. Mesenchymal stem cells are the stem cells that repair muscle, bone, cartilage, and tendons. They're commonly called adult stem cells. These stem cells are autologous, meaning that they come from the same person, so there's no risk of genetic disease transmission. These are the body's repairmen. They act as construction managers, helping other cells repair and build new tissue. Any risks with mesenchymal stem cells? So is it safe? Since these cells are the patient's own, there is minimal risk to the patient. As of 2016, there have been over 20,000 studies on this cell line. FDA states that it's okay to use these cells as long as they are put back into the same patient and they are minimally manipulated. Okay? So where do we get the stem cells from? They've been able to do a lot of studies on bone marrow, and some of the studies are very impressive. This is a study that they did in 2013, and they followed up after 3 years, 2 groups. One group did knee replacement, the other group did bone marrow stem cell. 3 years later, they compared them, okay, and they found that the ones that did the bone marrow stem cell were about as good as the one that did the knee replacement, except the group that was athletic was slightly more prone to go back into athletics if they did the stem cell, where the joint replacement, and I see this quite a bit, there's limitations, people can't kneel and they can't bend quite as good. So why in God's earth, if this was the reality, would anybody choose to get a hunk of metal put in their body and be out for months when they could have a stem cell procedure that would, you know, maybe cause some discomfort for a couple of days, right? You can start to see that this is the future, because this is what people would prefer. Adipose tissue is another place that we can harvest stem cells. In 2002, a scientist discovered that the fat around the midsection of the body was extremely rich in stem cells. This is Dr. Kensler and Dr. Bramson doing a mini liposuction on a patient. This is what the fat looks like if we were to kind of hold it up. It's very high density with stem cells. So let's look at and compare. Heart tissue, 1 out of every 40,000 cells is a stem cell. Bone marrow, 1 out of every 100,000 cells is a stem cell. That's bone marrow. Adipose tissue, 1 out of every 100 cells is a mesenchymal stem cell. After the age of 40, the stem cells really massively decline with humans, and the amount of stem cells and the viability of them decline drastically the older we get. However, the stem cells in the adipose tissue do not. From baby to very old, you have got this huge reservoir of stem cells. What we do is we do a mini liposuction. We take about a half a cup to a cup of fat. It takes us about 45 minutes to do the procedure. We take that fat into our lab and we add an enzyme to the fat, which basically dissolves the fat, and what's left is the mesenchymal stem cells. And we're able to take those and use those to heal patients in a variety of different ways. So adipose-derived stem cells can turn into virtually any tissue in the body. Stromal vascular fraction is the name for adipose-derived stem cells. They call it the stromal vascular fraction because when the enzyme's added to the fat, kind of like the little strands here with the fibrin, there's little strands that hold the fat together, and there's tiny little blood vessels that are in with the stem cells. So it's kind of a soup of all of those, okay? So that's why they call it the stromal vascular fraction, and that has a very, very high level of mesenchymal stem cells. So this is a study that they did, and they used monthly intravenous injections of 1 million human adipose-derived stem cells into 10-month-old rats until their death. Cognitive function as learning and memory improved, and lifespan was extended by 31.3% through regeneration of blood vessels in the brain and muscles. Through the research, intravenous injection of mesenchymal stem cells were found to move to the brain and differentiate into brain cells, which increase cognitive function and physical vitality by activating cholinergic, dopaminergic nerves, especially by removing chemokines called LLC11, which prevent regeneration of brain tissue. Mesenchymal stem cells induce regeneration of stem cells called neostin-positive cells in animal brains, which eventually regenerated the brain cells. It's a process where the SVF can be added into a bag of saline, and simply an IV is provided to the patient. And those stem cells will then go to various places. There's ways to influence them to turn into lung or turn into brain or whatnot. And there's different ways that you can kind of tweak the IV, but the technology is pretty amazing. The intravenous IVs are something that we do quite a bit on patients. Sometimes it's a patient coming in for an orthopedic concern like a knee, but maybe they have diabetes, or maybe they have some sort of neurodegenerative disease that they're also looking to treat, or they have just very chronic arthritis throughout their whole body or a lot of inflammation. This can be very rejuvenating. This was a professional football player that came to us. So one of the things that we started doing about 8 years ago is we started putting both bone marrow together with adipose stem cells. And we learned this from a doctor, another orthopedic, that had been using it, and we found that it was about 30% more effective if we combine them versus doing one at a time. And this was an image out of the study where you can actually see the cartilage regenerate. They've got see how rough this is? This is what we see with the ultrasound. For the knee, I can really look and bend the knee, and you can really see the articular surface, and if it's rough. And we see this on the ultrasound. And look how smooth it is. That whole cartilage is just filled in. Really amazing. This is a patient that we did in 2008. So we've been doing this for a while. You know, there's more doctors that are starting to do this, and you know, a lot of them are poorly trained. You know, they're just getting into this. This is the main thing that we do. We've been doing it a long time. We're very good at it. And there's a lot of technologies behind this that are making it much better. And we are continuing to improve it here at Advanced Rejuvenation. So in 2008, we did this knee with adipose stem cells, and this was 6 months after the injection. Wow. You can see quite a bit of cartilage formed on this patient. We'll look to see how rough that cartilage surface is, and a lot of times, like anybody that plays golf and you hit the green, you get that divot. Well, that's what happens in the joint. You get little chips and divots, so it doesn't have a nice smooth surface. What the stem cells do is they repair that cartilage and fill those voids to give you that smooth, friction-free glide surface. You know, cartilage is designed to last your lifetime. It has a 115-year half-life. So it's designed to last your whole life. But what happens is it gets injured, and we lose that smooth surface, and then that inflammation basically causes the natural lubricant in the joint to be thinned out. And so the combination of the chronic inflammation and the rough surface cause the joints to just deteriorate very rapidly. So that can be stopped and reversed with these types of treatments. So MarrApose treatment, we've already kind of talked about it. LumeStem with stem cells. So LumeStem therapy can positively affect human stem cells by increasing viability, proliferation, and differentiation. So what we're doing is we're causing bioactive molecules to affect the stem cells and activate them through LumeStem light photoactivation. And again, this is a picture of a patient getting treated. You can see how the knee kind of lights up, and the room's not, the lights are even on in the room, and you can see that. But when you turn the lights off, it's even more impressive. This is a Korean research which finds the possibility of adult mesenchymal stem cells may extend lifespan. So we already kind of talked about that with another study. So researchers in Korea have determined the possibility that adult mesenchymal stem cells, which can be from adipose, may extend healthy lifespan by intravenous injections. What we're doing is we're adding the stem cells IV, and then we're doing LumeStem IV on the patients. And so they're getting good results, but you should see the results we're getting. I mean, we have a lot of good majority of our patients travel in. a lot of them have a lot of neurological problems. So this is an interesting aspect of stem cells. They have the ability to home in on where there's damage. This was a patient that had a trigger finger. And so IV was done, like we were talking about with the different studies, IV stem cells. And then they tracked them because they put little markers so that that would show up on an x-ray. And a lot of the stem cells you can see went into the organs and the lungs. This is the bladder. And you see how a lot of them accumulated in the finger. So we know that when patients have injuries, that these stem cells are going to go to those injuries. We also know that it's going to go neurologic. We're also able to take the stem cells and put them what's called intrathecal, which actually puts them into the cerebral spinal fluid. Now I want you guys to be careful because there are some people out there claiming to use everything from amniotic fluid stem cells to cord blood stem cells. If somebody is telling you that they're using those stem cells, you need to be aware that there is no live stem cells in those tissues. There may be some powerful growth factors, but it is not stem cell therapy. And some of these doctors may think there are stem cells, but they're being deceived. I have a very reputable scientist that has taken samples from all the companies, and she's looked at them under microscope and testing, and there's no live cells there. Now, we do use some of those products occasionally for different conditions, but they are not stem cells. They will not grow cartilage. They will not regenerate joints like you're seeing here with this, okay? So why isn't this covered by insurance? This is kind of what we would feel like if we went to an orthopedic surgeon's conference. For more information about these exciting regenerative therapies, you can find us at advancedrejuvenation.us. You can also contact us by phone at 941-330-8553 or email us at info@advancedrejuvenation.us. If you found the information on this video helpful, please like us and share us on Facebook. You just never know whose life you might touch. Well, thanks for joining us. And remember, if healing is possible, consider it to be within your reach. Bye for now.